All right, and I'm going to share a document with you guys. I'm going to share it in the chat box. It's going to be a document that we're going to be following along. I'll also put it on my Google Drive here shortly. So hold on a sec. Let me upload this for you guys real quick. So, Facebook. Hey, Cyrus, come on in. I've got to sign in over here and then the sheet that we're going to be going through. So there's that. And if you want to take a pen and go fill it up and bring it back. All right. You're welcome to sit anywhere you like. All right, so the purpose of today's special think tank is going to be over like learning how to break down the book. And this is a big thing, whether it, your barrier might be that, hey, I've never professionally read a book, because we find that like one of the biggest barriers to being successful in this class is not being able to read. And it's not like, hey, you can read a book, if a regular book, but there's a lot of technical knowledge in these textbooks, and it's really hard to kind of all break it down and really know like, where do I start or where do I go? So, the purpose of this is to kind of break down some of those barriers, hopefully, and kind of get where you can start, or where you can kind of hone in on what you need to be focusing on for, this class and then other classes as well. So I dropped that document in the chat box. You can follow along. I will be sharing it here in a minute, but I'm going to talk about other stuff first. So, the first thing you have to do in order to, get in your textbook and start reading is you have to know what you are actually studying. Like, what do I need to read? And, that can be found for this class. We have the unit guides, the unit 1, 2, 3, and 4 guide that have page numbers. And you can also go in your SID and find out, because I have a lot of people that ask me, like for this section, like, oh, how deep are we going into hypertension? Or, we're doing hypertensive crisis. Are we doing acute decompensated heart failure? And we're not. So I'm going to share real quick on here. And what I'm opening up is the SID for those that are here. So I'm just looking at your SID. So if you have a copy of your SID, if you can maybe pull it up on your, on your Canvas. Let me share this real quick. So, okay. And so on your SID, if you scroll down, what you're going to find is all these objectives. And I know you always probably hate when you hear your professor and they're sitting there and they're like, hey, check to see what's in your objectives. And you're like, okay, well, I don't know how to read these. These seem like a bunch of words. So I want to first break down, like, if you're ever wondering, like, what's actually covered, because we have to follow these objectives. We can't test you on anything that's not in these objectives. So today is like the example of what we're going to use. We're going to do peripheral artery disease, just because that's something that I have coming up as well for my class. But if you go down on your SID, under the objectives, down to number 6. So let's say that, you're in my class and the next week we're going over vascular disorders, and you're like, what do I need to read for vascular disorders? And so, of course, you can find the page numbers in that guide, but it's like, but how deep do I need to go? Like, what do I need to do? So first you need to know, like, how deep are we expecting you to go? You can see on number 6, it says, all these big fancy words, but effectively what this is telling you is saying, what disorders do you need to know about? And then what do you need to know about them? So like it says there, you need to know about peripheral artery disease. You need to know about DVT. You need to know about thrombophlebitis, varicose veins, and venous ulcers. So these are the things that you can be tested over. And then it has all these bullet points and all these numbers and stuff like that. And that's where you might be like, oh, I'm not even looking at this. But this is really just telling you, what do you need to know about each of these diseases? You need to know, what are the risk factors? What is it? What does it look like? What does a patient with it look like? What kind of treatment are they going to get? Are they going to get surgery? Are there going to be medications giving? What labs do I need to monitor, et cetera? And then it's saying, as the nurse, you need to know, okay, how are you going to care for them? What are your priorities? And then what interventions are you going to do for each, and what can come up? And so this is a good starting point to kind of look as a whole, like overall, like what are you going to need to do? So before you start reading, it's great to kind of see like, okay, but what am I reading about? Which disorders? Because you don't want to be in the book reading about something that we're not even covering. And sometimes it's hard because we'll have like the start of one disease process and then it kind of like molds into another one as well. So yes. So and I'm sorry for the background noise. So what we're going to do after this, I'm going to kind of pull up this other thing. So you kind of have an idea about what we need to study. So then what we're going to do next, I'm going to share this other document. All right. So this is the document I put in the chat box. And if you didn't have a chance to grab it, I'm going to be putting it on my Google Drive here shortly. So let me zoom in here real quick. So, what do you call it? I was talking earlier, there's a couple different barriers to reading the textbook. Maybe English isn't your first language. Maybe it's that you feel like you don't really understand what the book's telling you. Maybe you get overwhelmed and stressed by it. Maybe you're anal retentive and want to read everything, or maybe you just don't know where to start. So I'm going to tell you a couple things that worked for me, because I should share that, when I first came to TCC, they never told me like, hey, here's what you need to teach. Here's how deep to go. Here's what you need to know. Because like, I didn't know any of the stuff that I'm teaching really before I came here. I knew the basics, but I didn't know any of it. So they pretty much gave me this textbook and they were like, here's the SID. Good luck. And so like I had to do the same thing that y'all are doing. It's painful to learn how to read this textbook, but I had to learn to break it down, because I'm like you, like I'm not someone who's like incredibly technical. I like things simple. So it took me a bit to kind of learn that. So if I always say, if I can do it, you guys can do it too. But if you guys learn this in this semester, even though you're going to have a different textbook next semester, you should be good to go to kind of learn, how can I approach this? Because even if you're thinking, oh, but we don't have your Google Drive, your resources, you can make your own reading questions and stuff kind of based off of the same ones, or based off of your objectives. You could write your own reading questions from those, like, okay, who's at risk for this disease? What does it look like? Like these are the same things you need to know for most of these disorders. So what I want to talk about first is in this first section, I wanted to bring up, we really the first thing is if you're one of those people that when you open the textbook, you're just like, okay, I'm going to pass out. There's so much information. Like, I don't even know where to start. It helps to start by breaking down, like, what does each section tell you? So if you have your textbook, go ahead and open it up. And I'm actually going to pull up the textbook electronically. Uno momento. I meant to do that earlier. Got distracted. So you can open your textbook, and we're going to look at the section over peripheral artery disease, which, if someone gets there before me, you can tell me what page it's on, but I'll tell you all here in a second when I get my book open. Alrighty, where am I? So I only chose this one just because it's something we're going over next week, and I figured it would be something that all of you guys maybe need to look at if you have not already. We're going to kind of use this as an example of something that we can do. So hold on one second. And by the way, I got so I was sitting here and I pull up I have my online textbook thing, and I was like, oh, it looks different. And they're like, oh, it's new and exciting. And I'm like, why can't y'all keep things simple? Like, I finally figured out how to use this online textbook thing. And they're like, we're going to change it now. All right, let's see. Okay. All right. So I am on page 800. If you are wanting to follow along with me in the book, so you can kind of get an idea. All right. So this is what my online textbook looks like. And let me see if I can get rid of there. You go. So this is what my online textbook. So I'm in chapter 37, which is vascular disorders. So the first thing you need to know is the book seems really scary if you don't break it down and kind of look at it and make it smaller. So when you're looking at these sections, instead of looking at this big terminology, like we're going down here to peripheral artery disease, this first thing that says etiology and pathophysiology. So you guys all took pathophysiology, it's about what is the disease process, but you may these big words sometimes, to me, I found them very intimidating. So I found it helpful to kind of break these down and look at what is this really telling me. So what I have in this first section of this breaking down the textbook is, what does this mean? So, I kind of showed you on your hey, you can come on over. I have a little sheet over here for you, and Cyrus has the sign in. Oh no, I have the sign in live. So yes. So if you want to take this whenever you're ready. What I was showing you when I was showing you guys the objectives, telling you hey, you need to know what this is, what it looks like. This is kind of going to help you. So if you wanted to use the reading questions and stuff like that, you can say, okay, well, where do I, if I am, let's say I'm going to use the reading questions, and I'll talk about what those are if you don't know what those are. Do you guys know what I'm talking about when I say reading questions? Yeah, in the study guide under the page numbers, there's it says hey, here's questions that you can go along with the reading. And I'll talk about that here in a little bit because I'm going to use it as a strategy. And don't worry, if you're feeling like you're lost, don't worry. I promise I'll hone this back in. It all makes sense soon. But effectively, what I mean is that sometimes, like I have those reading questions. It seems like great, I can answer these questions with the reading. But if you don't know where to look in each part of the chapter, it's really hard. It's overwhelming. It's like, where do I find this? So, kind of the thing I did in the beginning of this is how to break down the textbook. Is I have like, well, where are you going to find the answers to each of these? So, like this first section, etiology and pathophysiology. Effectively, what this section is telling you is what is it and who gets it. And that's important for you as a nurse because you need to know what something is. And, you can always start, with this section. You don't there's a lot, they have a lot of stuff in this section. And as the nurse, you do need to know what something is, but they go way too deep. So I'm going to kind of show you how to break down this section here in a minute. But, as a whole, you want to know what it is, who gets it. If you scroll down or turn your page, I'm not sure, however you're doing it, there's the clinical manifestation section. And that's just a big fancy word for what does a client with this look like? Thanks so much. And so, what are they going to, what kind of symptoms are they going to have? Or what are they going to complain about when they come in? If you keep scrolling down or turning your pages, there's the complication section. And so, this is talking about, okay, I always talk about in my class about okay, what's the worst thing that could happen to a person? That's what this section is. It says, okay, worst case scenario, what would this lead to? Because you need to know that as the nurse. You need to know, first we have the clinical manifestations. This is what the patient, if I'm going in, I have a patient with peripheral artery disease, this is what I should expect. And if they have that, that's okay. That's good because that's peripheral artery disease. But here's the things that if it starts to happen, I need to be worried. I need to know how to look for these things because it's going to be a problem. So that's what that section tells you. Kind of breaking this down too would help. Let's say you're doing practice questions and you're really struggling with a certain section. Like maybe you're doing practice questions and you're like, man, I'm really getting stuck in treatments, or I'm really getting stuck in these priority questions. This is going to kind of break down okay, if I'm really struggling with a certain section, where do I need to go and read in the book? And if you're struggling with knowing, hey, I didn't know that could happen with peripheral artery disease, well, come back and read the complications and see if it helps. I find that students tend to, if they're not doing well in practice questions, they go back and read everything instead of going back and focusing. And you guys just don't have the time to go back and read because, your time is limited. So you really want to learn, what are these sections, or what section do I need to go to if I'm struggling? Diagnostic studies, of course, talk about labs or other ways. How am I going to diagnose this, or how am I going to know, monitor, if there's any labs I need to monitor to see how a patient's doing? We talked about with diabetes, there's labs that we can use to see how they're doing overall, like a hemoglobin A1C, but there's also labs I can do to see how they're doing right now, like a random blood glucose. So it's kind of knowing that. Then interprofessional care, and this is something that I found confusing. This is the section, if you were a doctor and wanted to know how to treat this is that section. It's going to tell you, what does their diet need to be? How do we manage their risk factors? What medicines are we going to give? And you need to know that only in the extent you're not treating this patient because you're not ordering any of this stuff, but you need to know what orders to expect. You need to know if a doctor orders something, is that okay? Is that appropriate for this patient? But this is the section can really overwhelm people. Come on in, you're fine. Don't worry, I know parking's hard. Yes, I know, don't worry about it. Here you go, here's assignment, and then what do you call it on this sheet? We're kind of going over this sheet. We have our textbooks open as well. Yeah, no problem. Feel free to sit anywhere, and you're welcome to bring that back. You can keep that over there with you. So yeah, so this interprofessional care section is really going to break down what you're going to be expecting to see, or what's going to be, pretty much a part of this patient's treatment. Then the last section is the nursing management section, and it's going to take me a minute to get there, the nursing management section. So this really is, it breaks it down by the nursing process. So it says, okay, what assessments are priority for this patient? What the nursing diagnosis, which, we're really moving away from the NCLEX doesn't have where you have to do nursing diagnosis anymore, thank goodness. But pretty much the nursing diagnosis section, this tells you your priorities, what's the big deal, what am I most worried about here? And for PAD here, it's saying, hey, perfusion's the big deal, blood flow, making sure you're getting enough blood flow to those, that periphery to your feet. is going to be a really big problem. So this can, we're going to talk about this, but this is where you can really start to see, because I find a lot of students spend a lot of time in that first half of the section versus this section. And this is the section that's us. You're the nurse. You need to know how to manage this patient. You're going to need to know some of the background in order to understand why you're doing these things. But, you know, you have to really stay focused. So when you're studying, you should always be thinking, okay, I'm a nurse. I'm in that role to take care of that patient. What am I going to do as the nurse? I walk in, I'm taking care of them. What meds am I going to give? How am I going to assess them? What am I going to be worried about that could happen? So always try to put your brain back there, because I remember when I would study, I was studying on like a doctor level, trying to understand the gene level of each, you know, disease. And it's really hard. Like, you know, we really just want you to understand. We're not a lot of teaching about the patho. We're teaching you about how can you jump into this as a nurse. So they have the suspect, come on over, wait, God, and she has the sign in over there, and then here's the little handout for you here. There you go. There you go, perfect. So, and then we're just in our textbook, and we're on page, let's see, page 804. So then like they have a planning section. So this first is saying, the diagnosis section is saying like, hey, here's the really big problems. Whereas the planning section says, here are my like overall goals. Like, what am I trying to, yeah, I can hold on to it, thanks. What am I trying to achieve, or what am I trying to get from this patient? So like it says here for PAD, adequate tissue perfusion, pain relief, exercise tolerance. Like I can start picking these things up, because this is telling me what is, like when I show up, what do I need to be thinking about like for this patient? Like, you know, what am I going to be aiming for this patient? And I'm right now, what I'm doing is I'm just going through each section in the book saying like, can we break it down and make it more simple? Because sometimes you're like, okay, well, I need to read more in the book, but I don't want to reread the whole thing. So what do I find, what I'm looking for, what I'm missing? It's all about filling in the gaps. So then implementation is a big fancy word for what am I going to do as the nurse? Like interventions, like what can I do? And they always break the implementation section into 3 parts. So each chapter is going to have a health promotion, which means how can I prevent this? Has acute care, which means I'm in the hospital taking care of this patient. They are acutely sick. What am I going to expect? What do I need to do? What are my interventions there? And then I have a section that's called ambulatory care, which means I'm sending them home. They're about to go home. What am I going to do with this patient there? So effectively what this section is trying to do is it's trying to help you as the nurse to look through the nursing process. What am I going to assess? What am I going to be worried about? What goals am I going to have for the patient? And then what interventions am I going to do to meet those goals? Whether it's how can I prevent this or make it not so bad? How can I treat them when they're acutely sick? And how can I help get them ready for going home and being safe after discharge? And then there is a outcomes or evaluation section, which really is looking at my outcomes. Like, okay, well, if I do all these things, if I implement all these interventions, what am I hoping to achieve? Like, what am I, like, if I meet those goals, what is the patient going to say? Hey, you know, I'm going to be able to tell that they have better perfusion. They're going to be able to tolerate activity better. Their pain's going to be improved. So kind of breaking it down like that. I'm going to take a pause, because I just said a lot of stuff all at once. Does that make sense, kind of how the book is broken down? Does anyone online or otherwise have questions? Okay, I'm hearing none, or people have fallen asleep, one or the other. What do you call it? So, what do you call it? I just wanted to kind of break down that first about like, what are the different sections? That way, again, like if you're not sure about like, you know, you're trying to answer a specific question, or you're struggling with a certain part of what you're like learning about, like maybe your teacher went over something in class and you're like, I didn't really get what they were saying about, you know, why we're going to be treating this disease this way. Like you can come in the book and find the section that's going to be, you know, most specific for what you're looking for. So now I want to kind of talk about actual practical. So, because I've talked to you about, you know, for those that came in a little late, pretty much what we talked about is that first you always have to know where what you need to read. So you always have to start with looking what page numbers do I need to read, or you can also look in your SID, and under the objectives, it tells you here's the disease processes you need to know, and here's what you need to know about each one. You need to know risk factors, what it's going to look like, etc. So you always want to start there, because you don't want to be reading something about something that you're not even covering. I have students come up and start asking me questions. I'm like, whoa, we're not covering that. And so you always want to make sure you're reading stuff that actually applies to what you're going to be tested over. And, you know, we really try to test you over on what's common and, you know, what's deadly and what you're going to see often in the med-surg units. So I've come up with 2 different methods of going about reading the book. So let's say, you know, you had your class this week and you're trying to figure out how do I get prepared to read for next week. So I'm going to teach you 2 different methods. And sorry, go ahead, Angela. Did you have a question?
Yes, I had a question. You broke down these sections, but sometimes the sections have a lot of material. So do we just focus on the most priority or like all of that?
I'm going to go through that in this next section about
Oh, okay, thank you.
yeah, that's a great question because yeah, sometimes some sections like dysrhythmias and stuff like that, they don't have that same breakdown, so it's a little different. So I'll kind of talk a little bit about that at the end. But I'm about to talk about well, okay, that sounds really simple. Okay, here's the sections, but really there's so much. Like some of these sections are like pages long, and you're like, yeah, but what's important there? So I'm going to talk about that here in a second. So um, I kind of have two methods that I'm going to talk through. One's called the layered method, and one's called the reading question method. You can use both of these, one of these, none of these. You can find something that works for you, or take bits and pieces that you like and find something that works for you. But here's just a couple suggestions, especially if you're really struggling with like, okay, I'm getting really overwhelmed with the reading, or I don't know where to start, or I feel like defeated by this textbook. So first, the layer method, the first layer is going to be there is skimming prior to class. So let's say you have class next week and whatever you're studying, and again, we're going to use peripheral artery disease as an example. What I always like to do if I'm going to skim before class is I'm going to start in this nursing section, and I'm going to do kind of what we were just doing, where I was sitting there and I'm starting with, okay, I'm the nurse. I'm going to be taking care of a patient with peripheral artery disease. The first thing I need to do before I start reading is if I can figure out what the so what is, what's the big deal? Why do I care about a patient with peripheral artery disease? What am I really focused on? That's really going to help. If I'm just sitting here reading about this and I'm already confused, I don't know what this thing is, like it's really going to be hard to focus. So I need to figure out, okay, what's the so what? And I can find that if I start in the nursing section, in the nursing diagnosis. So we talked about the big issue here is if you see the word perfusion, what do you think? What do you think when you hear perfusion?
Oxygen.
Yeah, oxygenation, blood flow. So it seems like there's an oxygenation or blood flow issue. So I already kind of know that. Even if I had no clue what peripheral artery disease is, I know that there's a problem with blood flow or oxygenation. And then activity intolerance. And what does that mean when you guys hear that?
How much they can do, maybe?
Yeah.
Like the tolerance of exercising?
Yeah, like pretty much how much can they tolerate exercise? So it looks like they're having a problem here with oxygen, getting oxygen somewhere or blood flow somewhere. And it says tissue, so somewhere in their tissues, and then that they don't tolerate activity. So I'm already kind of getting an idea. Okay, this has something to do. This is going to be like my thing here is going to be about oxygenation or blood flow and stuff like that. So I just need to kind of get an idea about that. I want to get that so what. I might look here at some of my like goals here. Like I kind of told you guys, it looks like they're goals under the planning section that I want them to have good blood flow, oxygenation, pain going away, do better with tolerating the exercise. Looks like skin might be an issue, and that knowledge, or they're going to need education. So I'm kind of getting ideas here about some of the things. So already, like I've kind of learned a lot, and I don't know anything about peripheral artery disease, but I know it's something wrong with oxygenation. I'm not tolerating exercise, and I'm going to have pain because it says that one of my goals is relieving pain. So I can already start kind of picturing this patient. They have decreased blood flow. They're not oxygenating well. They don't get up and move around very well, and they have pain. So I already can kind of start to form a picture. And then what I can do at that point, you really want to, after I've kind of figured out, okay, so here's kind of a general picture. Here's what I'm worried about. When I'm reading, I really want to focus on that. So Angela, earlier when you're asking, like, how do I know what to focus on? Here's like some of my big problems. So I really want to see, okay, how am I going to assess for that? What are they going to look like? If they, I think they're going to have a, some sort of blood flow oxygenation issue. Okay, but what's that going to look like for this patient? Like, what am I going to assess for? Yeah, come on in. Are you guys here for the thing? Yeah, come on over. Yeah, there's the paper over here and the sign in as well. So yeah, so here's 3 of them for you. You'll pass them behind you, and then there's the sign in. So yeah, no problem. So and we're reading through. We're gonna go back to page 800, but that's where we're in the book. So. Oh yeah, you still haven't gotten back in. So yeah. You want to use my book while we're doing it? Here, go to page 800. There you go. All right. So yeah, so and we have our books open. We're on page 800. If you have your book, electronic or otherwise copy. So after I've kind of figured out, and I'm going through right now, I'm talking about this layered method that you can kind of go through and start breaking stuff down. So I can always start with, like I said, figuring out what's the big so what, and then as I was telling Angela, like, as we're reading, I can start breaking down. Okay, with my big so what is it's about oxygenation. I'm worried about their pain, their ability to get up and move around. When I'm reading, I'm going to kind of focus my mind on those are the big problems with this patient. So this is what I want to focus on. So after I read in the nursing management section, I'm going to go back and start looking up and trying to find out, okay, well, I don't know what this thing is. Let's say I know nothing about peripheral artery disease. So I'm going to go back to the front. I'm going to go over here. So I start reading, like, here, there's a bunch of statistics, there's ages, there's all this stuff. And I'm like, oh God, what is this? And so I usually recommend, so I'm talking right now about what you just want to do prior to class. I usually recommend just to figure out what it is, read the first couple sentences, because usually what it is going to be in the first couple sentences. And it says, it involves thickening of the artery walls. This results in a progressive narrowing of the arteries of the upper and lower extremities. Now, let's say that makes sense to me. I say, okay, things are getting narrow. And I remember, because I've already read in the nursing section, I have a problem with perfusion. So I'm starting to connect the dots. Hey, my arteries are getting narrow, so I'm having less perfusion. So I'm starting to kind of connect the dots there. Maybe that doesn't make sense to me. What I really recommend is if you're reading this etiology, pathophysiology, and again, just reading the first couple sentences, and if you're like, oh no, I don't know what that is, go get on YouTube and search for peripheral artery disease and nursing. Find a video and watch it, because I find patho videos, like patho is really hard. And if it doesn't make sense to me, I have to visualize it. So I like those ones where people draw stuff out and I can really see like what's happening in the body. But just watch a video. You don't have to watch like a crazy long one, but just figure out what is this? Because that's the first question you want to ask. Like I have here on this worksheet that like your goal is to say, like, you want to figure out what's the problem. So I already kind of know what some of the issues I might have as the nurse, but the problem here is it seems like they have this narrowing of their arteries, and that's causing them to not have blood flow, and it's causing other symptoms like pain, and then they can't get around and move around well. So yes, that's the first question I want to answer. Is there any questions about kind of getting started in this skim? And right now we're just skimming before class. Does that make sense so far? All right.
Yeah.
All right. Good.
Yes.
All right. So thanks, guys. So then the second question you're going to try to answer is, what does this client look like? So we already kind of got a little idea when we were reading in that section. We learned that, okay, they're going to have pain, and then they're going to have signs of poor oxygenation, but it's really hard to say, okay, but where's that? How am I going to see that? So I'm going to go down again, because we kind of broke down what we did already, guys, is we broke down the sections in the book to make them more easy. So instead of sitting there and being like, I have to reread everything, it's like, where am I going to answer these questions? So if I want to know what a client looks like, I'm going to go to the clinical manifestation section. So I'm going to go in there. Now, this is kind of one of those things that we were just talking about, that, well, what if it's really long? Like, look, all this stuff here, it's pretty long. Like, how are you going to break down this textbook? And that's pretty complicated. It's like, oh, there's all these words. But look, in the book, you can see things like some things are either italicized or bolded. That should stand out that this is something important. And what word do you see in this section that's bolded?
Intermittent claudication.
Yeah, the intermittent claudication. So that should stand out to you. Hey, this is probably something important if the authors chose to bold this word. So you can go ahead and kind of put that down, even if you don't know what it is. You can sit there and kind of put like a little star by it in your notes or whatever and say like, okay, this is probably something that's important. Then you see, what else do you see that kind of stands out in this section that they've obviously they've kind of tried to highlight for you? Do you see anything else highlighted, italicized, bolded?
The additional chapters?
The paresthesia?
Yes.
Oh, okay.
Oh, yes. Yeah, I know it says chapter 48. It looks like it's highlighted there, but I'm thinking stuff like this, where it says like elevation pallor, redness of the foot, this reactive hyperemia, dependent rubor, like all these things, like these are terms. And even if you're sitting there and saying, I don't know what that is, start to put them down. And like, this can be something that you can look up. But like, instead of sitting there and trying to read this whole thing and like read these long sentences, you're just trying to pick out like, what is this picture of this patient? Because remember, this is before class. You should be able to go to class and be able to say, what is it? What does it look like? And, what's my nursing care focused on? Like try to, like I have here on my page, this little paper I gave you, try to sum it up in 3 or 4 words. So we could sum this up: intermittent claudication, which, you know, we could look up and find that's pain with walking. Like when they try to walk, it's kind of like, this is like when you have a heart attack and it's hard to like play golf and do other activities, when like the chronic stable angina, you're getting up, walking around, you get chest pain because you're exercising. It's the same, but it's in the legs, you know, it's like where that's narrowing. And I'm just giving you that as a clue. But if you didn't know that, you could go look that up. If English is not your first language, that might be something you have to look up. That's why I say it's actually helpful sometimes to have friends, like, you know, even like, you know, there's a lot of people that it's not even that, what do you call it? They maybe are bilingual and they speak multiple languages. Sometimes it's like, I know that I've been told before that people, you guys get like things mixed up in your head. You're thinking of it in Spanish instead of English, or you're trying to connect it to that other language. It can be really hard. But you need to find a way to make sense for you. So you don't even need to put intermittent claudication. Find a way to word it in your own words, if that is what makes sense to you. So like pain when walking could be intermittent claudication. This, like, you know how it has these other words at the bottom, it says like pallor and elevation pallor. Like, and if you're like elevation pallor, what's that? You know, and you could put foot turns white when elevated. Like, make it really simple, put it in your words. And, you know, I know some people like Cyrus have the really science brain, and if the science brain works for you and that helps and you like those words, then use those words, but you need to find whatever works for you. So yes, so you know, that's what, you know, kind of in this section, all you're doing is picking out a few keywords, like what is this patient going to look like? So far we've built an image of this patient. They have decreased blood flow in their legs. It seems like in their peripheral extremities, because it says, you know, the classic symptom. By the way, that's also a good key here. Anytime you see the classic symptom or classic symptoms, you always want to write those ones down. Because remember, in nursing school, we're dealing with pretty much like what is going to be the most common or the most deadly thing that's going to happen. So you're always going to look at what's the classic. What am I going to expect? If the perfect patient was sitting right in front of me with the perfect presentation of this, what would they look like? But you just want to write down. Oh, so anyways, let me back up. So I was saying, like, the picture of this patient, they're having pain, having trouble moving around because they have narrowing in their narrowing of blood flow in their legs. And so that's causing a lot of their symptoms. And they might have pain when walking. When they elevate their legs, it turns white. When they, what do you call it? When they put their legs down, it turns red. So you can kind of see they might have numbness and tingling and stuff like that as well. So I'm just getting a general picture, and this is all before class. And then you can go down to the interprofessional section, which, remember, this is the doctor section. This is the section the doctors needs to know. And sometimes this section, it depends. Let's see, where is I? Oh yeah, here I am. And so sometimes the section, it's nice, it's split up like this. And so when you're skimming this, because remember, Angela, you were asking, oh my gosh, there's so much here. What do I do? Before class, just try to read the headers. So what is it saying here? The overall care for a patient with peripheral artery disease, there's risk factors that I can work on. So it's saying, hey, there's something the patient can do to prevent this from making it worse. There's medications I'm going to give. You don't even need to necessarily dig in deep, because I know once you see medications, y'all are like, oh no. And so it looks like exercise is going to be key. So all I'm doing is reading the headers as I'm going down. Nutrition. There's other complementary and other therapies. And it looks like they even have procedures that can be done. So all I'm doing is kind of in surgeries. So all I'm doing here is trying to figure out overall, what should I expect? Like, so this patient may need medications, they may need surgery. There may be other things that they can do for themselves as well. So that's pretty much what I'm doing prior to class. So yes. Any questions so far about kind of that skimming before class?
Mm-hmm. I just have, it's probably a dumb question, but on the, where it says, where you type in, I guess the disease process, are we actually using the quotations?
Mm-hmm. Oh, are you talking about when you're looking up like a YouTube video?
Mm-hmm. Yes.
Yeah, so usually you want to put it in quotes, because it will help you, because if you just put peripheral artery disease, it's going to search for anything that has peripheral artery and disease. But if you put peripheral artery disease in quotes, then it will search for just stuff that has that whole word together as one. So in other words, you can do either, but you're going to find better luck if you search peripheral artery disease quotes and quotes nursing.
Okay, so you do use both.
Correct. Yeah.
Okay, thank you.
It's hard to kind of write that without, putting it out there. So yeah.
Okay, thank you.
No problem. So then, and what she was talking about is I was talking about at the beginning with the patho. If you're really struggling with the patho, you can always look up videos. So I've kind of gotten an overall, and then I'm going to go to class, and my professor is going to hopefully show me some stuff about like this disease, and I can start connecting. So when you go to class, like I think a lot of students feel like they have to read everything and know everything, but you get to class, but it's all mixed up and you can't keep it straight. So it's better to go to class kind of having a general idea, and then let your professor add to that. Let them kind of, show you and be like, okay, here's another thing to add to peripheral artery disease. But you can also start to connect things, be like, oh, hey, this makes sense, because I remember this is about blood flow. So this is probably why we're doing this. So then after class, there's a couple, I have two options for you here. One option is you can take your notes, your professor's notes, and you can compare them to what's in the book. And you can kind of look side by side, because usually most professors break their notes up the same way the book does. So you could do that and kind of, really focus on these three things. Think, what would you need to assess for? What do you need to teach the client? And what are you going to do to provide care? Really focus on those, because that's the other thing. When you're reading and you're going into these, there's all these like little details and stuff like that. Like right now, like the section I'm on is talking about all these things that, doctors are going to do. And maybe I need to know to expect this, but I'm not putting a stent in this patient. I'm not doing a cryoplasty. So I need to focus on, okay, but if I have a patient that's had that, what am I going to see as the nurse? What do I need to do as the nurse? So I always try to home back in and think, okay, what's my nursing process? I'm going to be assessing, I'm going to be teaching, and I'm going to be providing nursing care. So how am I going to be doing that for this? Because I can find myself, sometimes I go in deep and I'm like, wait, I got to pull myself back. So the other option is that you can go into the book, you don't have to have necessarily your notes, and try to go a little deeper. So now that we've already found out, okay, what is this? Like, what's the big deal? Like, what's the big so what? Now I need to go a little deeper. Like, what are complications? So I already know what's normal. You always need to know what's normal and then what's a problem. And so what section did I tell you that you're going to find, where there's going to be a problem? Complications. Yeah, complications. So let's go to the complications section. So under the complications section, it's saying it progresses slowly, and then it starts using all these big fancy words. Prolonged ischemia leads to atrophy of the skin and underlying muscles. Well, let's say you get to a sentence like that and that doesn't sound like English to you, and you're like, I don't know what that means. Skip it for now. Let's go back to it. Let's kind of see if we can break this down and make more sense. It says minor trauma to the feet can result in delayed healing and infection. So it looks like, if I remember back in that nursing section, one of my goals was skin health. Like, I was worried about their skin. So this kind of connects to that. Okay, so I don't want them to have, to cut their feet. What does that remind you of? Who did we also worry about foot care with? Diabetes patient? Yeah. So it's really good when you're studying to kind of connect this together, because you're actually going to find, hold on one second, I think someone's trying to get in. All right, there you go. You can actually find that, in this, like connecting this, that we're going to actually talk about this, but the care that we give for peripheral artery disease is the same teaching that we did for diabetic foot care. It's the exact same teaching. So it's kind of cool. So I don't have to sit there and relearn something. I can just kind of draw from that other information. So what I'm seeing so far here, I'm trying to find out what's common complications or deadly complications they could have. It looks like they could have really bad wound infections, or they can have breakdown. And if I think about it, I'm like, okay, what's the problem here? They're not getting blood flow. Well, okay, if I'm not getting blood flow, of course I'm not going to heal. So I like to make sense of things. I'm not someone, you can tell me like, hey, memorize this, but if it doesn't make sense to me, I'm like, but why? Like, I like that why. And so if you can start thinking about it, okay, well, why would trauma matter? Why are they having delayed healing? Oh yeah. And then I start remembering that word ischemia means like lack of blood flow. So pretty much what it's saying here is that there's less blood flow, and because of that, I'm going to be worried about breakdown. And it looks like they can have ulcers, and infection is a big issue. So that's kind of in my head. Okay. So coming in this patient, they're already having, decreased blood flow, maybe pain, trouble walking, but I need to watch their feet and do a really good foot assessment. So that's going to kind of like, I'm kind of taking notes here and making a note that that's something important for me. And then I also want to look at, if I was taking care of this client, like I have here under these bullet points, like what assessments or orders and treatments or teaching would they need? So I want to go a little bit deeper. So then I want to think about, okay, where's the problem in peripheral artery disease? What part of their body? Extremities. And usually it's going to be the legs. Usually it doesn't happen too often in the arms. So then I have to start thinking about, okay, well, what assessments can I do? I really want to think, I'm going to imagine this patient sitting in front of me. Okay, what assessments do I need to do? So what assessments do you think you need to do in this patient? Pulses, edema, like the neurovascular assessment. But if I wasn't sure, what section could I go to? Nursing assessment. Yeah, you can go down to that nursing section. and you can go under, what do you call it? It says there's a table here, 37.4. So let's go here. So under here, this might be another table that usually you'd be like, oh, but let's break it down and make it simple. Under this table 37.4, it says nursing assessment. It has like subjective data, functional health patterns. That doesn't matter. I'm talking about the physical assessment I'm going to do. It says here, objective data. So integumentary, what does that mean? Skin. So yeah, so this is saying here, yeah, thank you so much. Loss of like hair on legs, etc. So this is saying one thing that I need to do. This is telling me everything I need to look for. I need to do a cardiovascular assessment. Here's telling a lot of that stuff that you guys said. Neurological, and this is not talking about neurological up here. It's talking about that neurovascular. It's saying what's their sensation. Remember, if we go back, remember we saw one of our key symptoms because it was italicized was numbness and tingling. So that I kind of connect that dot. And then there's some, I'm not going to go into diagnostics. I'm going to just focus on, okay, me as the nurse. So here it broke it down. It's not saying here's the head to toe you need to do. It's saying you need to look at their skin. You need to check their peripheral, like vascular part, and you need to check their neurovascular as well. So it's really starting to break it down for me. And then where would I look to find orders and treatments that I might have? In nursing implementation. So I can look up kind of the role of the nurse. And remember, I told you for this section, health promotion is like, how can I prevent this from happening? But I want to focus on acute care because that's what we have some of the teaching and other stuff and prevention stuff, but most of our things we have, hey, you're in a hospital, there's a patient with PAD, what are you going to do? And so you really want to focus on this acute care section. When you're thinking of teaching, you can go into the health promotion and ambulatory care, because that's going to tell you, okay, well, how can I prevent this from happening or make sure when they go home, they have the teaching they need. But acute care is going to tell me as a whole, what am I going to do? So it's saying here, okay, there might be some interventions that I do. I need to, check, the same stuff we were talking about, all those assessments. It's saying pain management's really hard. And really what I'm doing after class, like I'm reading a little deeper, but I'm still kind of skimming and trying to get a overall idea. Because a lot of times this book, it's very wordy and it says like, it'll have a whole paragraph pretty much just saying, hey, like this whole thing, PAD, history, chronic pain, tolerance to opioids, and thus aggressive pain management may be needed. Okay, so I mean, the big point there is I need pain meds. And so the more that you read this, and I think that that's the hard thing, is you have to get a little uncomfortable reading. And like I said, I had to do this too, and I hated this book, and I threw it a couple times when I first had to learn how to read it. But when you start to kind of break it down and say, oh, okay, here's what it's really trying to say, because it usually will sum it up. And so this is, and actually this acute care is just talking about post-surgery. And I'm like, okay, but what about in general? And so I actually can also go, I'm just looking, this is all talking about that. So under the ambulatory care, it can tell me in general, kind of long-term, what I'm going to need to do for these patients. And it's kind of says there's some meds I might need to give, supervised exercise training. That's a lot of prevention. And then it's saying stuff about like foot care is important. Overgrown toenails and calluses are potentially serious and need regular attention. So that kind of ding, ding, ding in my head, that's something that could happen. It goes back to that foot care. And then it's starting to talk about some of that foot stuff as well. Like, how I'm going to give that care. So it seems like a lot of this, my role as the nurse is preventing this or trying to make it not get worse, really do those really good assessments, and then trying to make sure that they're taking their medications. I can always still go back to that interprofessional section and read a little deeper, because remember, all we did the first time was like look deep and look at like what the headers were, but I can look a little deeper and say, okay, well, I knew that there was some medications, but what medications am I going to use? And usually, especially if they have a box like this that says drug alert, that's usually like your sign that there's a medication and it has something that you need to know as the nurse. So I usually try to notice those drug alert boxes. And so you want to kind of keep an eye on those. So like, because usually they'll tell you, hey, you shouldn't use that in this patient. But pretty much like you don't have to, again, like if you're one of those people that you start reading these sentences and you just feel like you're going to die inside, like try to get the overall picture. So like picking out some of these names. So, okay, ACE inhibitors can help to reduce symptoms. Antiplatelets, or aspirin, stuff like that might be used, or clopidogrel. And it's saying here anticoagulants are not recommended. Okay, all right, so yes, so. And so then there's also, they have this symptom of intermittent claudication. They have a couple meds that I might use for that. And so I might just start writing those out. Is there any questions about that second layer? You're pretty much just digging a little deeper, trying to get a couple more pieces and really start thinking of that nurse's role. So focused assessments, orders and treatments, and teaching. And the teaching, of course, like we said, it's in that health promotion or section in the nurses section, or you can also find it like in health promotion, encourage patients to do this. It says like in health promotion, encourage patients to obtain regular follow-up care, teach diet modifications, teach proper foot care. So I'm kind of seeing what, my teaching is there. Any questions about this section, kind of what you do after class? All right, so then the next thing is that you don't want to spend all your time in your book. You've gotten kind of a good foundation from the book, but now you want to go out and you want to start practicing things. You're going to have to come back to the book, but you want to start by, okay, let me just fill my gaps and my holes. And so I'm just checking the time real quick here. All right. So go do practice questions, case studies, fill in worksheets, whatever, helps you, watch videos, etc. And start digging deep. And when you start seeing something, like maybe you go to class and your teacher's talking about something, you're like, what the heck are they talking about? I don't remember reading about this. Make a little note of it, put a star by it in your notes, or make a little note in your notes that, hey, I need to go back and read about this, and go back in the book and find out, where that was and start reading a little bit more about it. If you're getting a bunch of practice questions and they're bringing up a medication or a treatment or like a priority question, you're like, oh, I'm getting this wrong. Go back in the book, but make sure to use that first page thing that I told you about, like that breaks down the book. Don't reread the whole section, but find that section that really is whatever you're missing. Like if you're missing the teaching, like if you've gotten all the teaching questions wrong, go back and read a little bit deeper and see if you can. But this way, that this book gives you a good foundation, and there's a lot of really important details and stuff in here too, but you have to start with the basics first. And a lot of people wait till the end to test themselves over like practice questions, but a lot of times you can look at practice questions, and even if you're getting them right, be like, man, there's a lot of questions about this. Let me go back and make sure I understood this in the book. But it's going to help guide you. If there's like 15 practice questions over the same topic on PAD, you probably want to know that well, so you could go in and go a little deeper. But that's going to help guide you. Or if you're doing a fill-in worksheet and you're filling in, okay, I know this, but I don't remember anything about medications for PAD. Let me go in. And if you're not really seeing what you need in this book, you can use your Lily book as a supplement. I do recommend, if you use your Lily book, that you're not reading too deep into the patho of it, and you're mostly focusing on, okay, what do I do as the nurse? And that section's at the end of your Lily chapter. It's going to say, okay, I'm giving this med. What do I need to do? What do I need to assess for? I'm giving this med. How am I going to know it's going to work, etc. So I'm focused still on that nurse's role. But yeah, so pretty much what you want to do is you're not rereading everything. You're just filling in the gap of whatever you might be missing. Does this make sense so far? All right, so that's the one method. That's the layered method. Oh, sorry, go ahead.
I said, yes, ma'am, it does.
Oh, perfect. So yeah, so so the other option is the reading questions method, and I'm gonna take this, and you can use both. You could do the layered method and use the reading questions. You could do just the reading questions, just the layered. You can do take a little bits of each. These are hopefully going to just give you some options, so it doesn't feel so hopeless. Because I remember when I first started, I was so hopeless with this book, and I was like, there's no way I'm never going to learn this. And so it's hard when you just don't know what you don't know. So the reading question method, and if you don't know my reading questions, I can pull up kind of to show you guys that are online. But do you guys know what I'm saying when I say the unit guides? And at the end, like they have page numbers at the beginning, your instructor should have given them to you. Or posted, they're probably posted somewhere on your Canvas, but underneath them, there's also a section that has reading questions. So I'm going to pull up the ones for PAD here real quick. Let me find here. Oh, it's down a little farther. So let's go under the Unit 2 guide. So my other option is, and there's 3 options under the reading questions method. The first thing you can do is you can read the questions prior to class to prepare for lecture. You can read the questions after class to test, to see if you knew, did you really understand that? Or you can do them right before the exam to kind of evaluate. Now that's the one I would least recommend, because if you're waiting until the end to see if you really know it, then you don't. You're like, oh no, I don't know this. It's kind of hard. So I recommend option 1 or 2 is probably the best, but either all of them work. So just depends on where you're at. So let me find this here. Find heart failure, vascular. All right, peripheral artery disease. So breaking down like pretty much what I have here, like for option 1, let's say you did this before class, is you're going to take these questions. And so for those that don't know them, like some of the questions are, what causes it? Who's at high risk? What symptoms are expected? What symptoms are a sign of a problem? And you can kind of already see that layered method. We went through a lot of this, but it's either way. But these kind of break down what questions do you need to answer. So instead of going in and just looking in the book and trying to break it down yourself, you could use these and take these with you and say, okay, I'm on a mission. I need to answer just these questions in the book. That way you feel more focused. And you can also still use that front page that I have on this breaking down the textbook and start saying, okay, I need to answer what causes it, who's at risk for it. I'm going to find that under the etiology and pathophysiology section. Okay, so I'm gonna go there first, and you kind of start breaking down. And so you didn't have your hand raised, did you? Okay, I was just making sure. And so, pretty much you're gonna go through, break down those questions. You're only answering those questions. So that's the thing. If you're a person that struggles with how deep to go, if you're starting to read something and it's not directly answering your question, move on. If maybe you need to look at it later, but right now just focus on answer. Your only goal is to answer these questions. And when you're answering them, you do not want a long, complicated answer. You want bullet points, simple responses in your words. So, I do not find it very helpful to memorize stuff word for word from the book. I find it very helpful to write things in my own words and bullet points, just really simple. When you're answering this. So what causes it or who's at risk for it, and I don't need the whole list. Like, I've seen some students, they'll just copy and paste like the whole, like they'll have a long list. Here's all the people that could have PAD, the 15 people. Sometimes the book will actually say in the paragraph, like, who's the highest risk? Is it men? Is it women? Is it older people, younger people? Is it people with a history of something? Really focus on what the book's telling you, like the most at risk people. And then, try to also get a picture. So if it's like, older white men, then, put older white men. You don't need to have those 3 separate categories. Who as a whole is usually going to have this, or what else, if I had a patient that came in with PAD, what else might they also have in their history? Take a drink of water real quick. So the other option, let's say that you use this after class. Same thing, you want to take, you either can do this verbally, like you don't have to write these out either. If you're more of a verbal learner, you can also, say these out loud, or you could do these with a study buddy or something like that. You guys could take turns, say, okay, you answer the first question, I'll answer the second one, or you both could answer it and see what each says, and then kind of see, maybe if there's something that they understand that you didn't, etc. Or maybe they understand it in a way and you're like, man, that's so much more simple. Like when Cyrus told me about that A through M thing yesterday, that, all the cardioselective beta blockers are A through M, and then N through Z is the non-selective ones. And I was like, that's so much more simple than anything I've ever made. So yeah, it's kind of cool. That's why we learn from each other. So pretty much you can do this. And a great thing about this, if you're doing it after class, is that, like, let's say that you should try to do these without your notes. Like, try to answer these without your notes if you're doing it after class. And let's say you get to one and you're like, ooh, I know what's expected, but I don't know what the sign of a problem is. Then mark it and say need to read. Then that you go back and fill in that gap. But you don't need to go and reread everything about PAD after class if you really got these questions down and you feel like you understand that basic. So I'm going to try to answer these questions. Let's see. If you can't, like it says here, go back and read about it. Try to answer them on your own, and then fill in the gap. Because it's easy to fill these questions out if you have your notes right in front of you. But what did you really get from class? Because I can tell you, even let's say that you got it down in your notes, but maybe you didn't really click with you. Maybe that's your cue to like, hey, I need to go back and look at this a little bit deeper. So the other option is doing it prior to the exam to evaluate, and it's the same thing. So you can kind of go through these right before and say, okay, like no notes, just your brain. Can I answer these questions? And you can also use them multiple times. You could use the reading questions all 3 times. You could use them before class and then see after class, can I still answer these without my notes, without my book? And then right before the test, hey, can I still answer these? Or, if you want to bother your family, you're sitting at the dinner table, hey, let me tell you about how peripheral artery disease is diagnosed. I know you want to know about it as you're eating your broccoli. So yes, so you can talk to them about it. You could talk to a friend about it and kind of test yourself right before the exam as well. So those are the 2 methods that I have. And of course, there's plenty more methods, but I think that these are the simplest ones. And again, you can use like bits and pieces of these or kind of use these to break stuff down in different ways. Is there any questions about those 2 methods or anything about how to utilize them? All right, so I have a couple what to do and not to do on this worksheet that I gave for you guys. I said, really focus on the role of the nurse and how this will apply to your day-to-day nursing care, but don't try to understand the deep patho, because, you go deep into the patho, you get lost. You use it as a resource, but this book shouldn't be your only resource. I had people that literally have had this book memorized and still failed exams. It's not about having this book memorized. It's about applying it to situations. And I find that most people, the first exam, you go to an extreme, you're like, I'm going to do a million EAQs. I'm going to read my textbook. I'm going to just study my notes. But it's really finding a little bit, like pick and choose little resources. You don't need to do everything, but you need to do a little bit of reading, a little bit of practice questions, a little bit of writing it out, maybe watching some videos, some other things. Pick 3 or 4 things, and those are your things. And some sections you might need to rotate them through. Like next section, there's not as many meds, yay, right? But there's a lot of different disease processes. So there's all the musculoskeletal, and so it's like differentiating all the disorders. So you might have to watch more videos because you're like, oh, I don't really understand what the difference between this one and this one is. So you might have to do that. Where this section, since cardiac is so awesome and easy, it just like comes naturally. So it just kind of depends. But you're gonna have to kind of have like a couple, 3 or 4 of those like resources you really like to use. And if you use more, great, that's fine if you have the time to do that. Do read and consider what orders will be expected, but don't take on the role of that physician, and you'll never need to choose which medication or treatments are most appropriate. I know you may think, oh no, I've had a question like that, but you have to know what's safe. Like if I give this medicine to this patient, they're going to bleed out, but it's not your job to say, well, should they get aspirin or should they get Plavix? Like, like that deep stuff. So if you're starting to ask yourself, like I've had some students like ask about about this whole beta blocker situation, you're never going to have to sit there and be like, you're going to need to order this beta blocker. But if you got an order that said, hey, here's this beta blocker, it is your job as the nurse to say, hey, in their history, they have this, and to say to the doctor, hey, I don't know if you recognize they have a diagnosis of asthma as well. Is this still the medicine you want to order? So it is your job to be that stopping point, but you're never going to have to choose which medication or which treatment. You never have to know, like, okay, like with the dysrhythmias, it's not going to be your choice, like, okay, are we going to do drugs first, or are we going to try cardioversion first? That's going to be up to the doctor, but it's your job to know what assessments you need to call the doctor with to let them know so they can make that decision. So let's see. So like it says here, we make recommendations, not orders. You do not need to use a dictionary to look up every word in the book. And I found, because I was going to use heart failure as an example, and the heart failure nursing section is super complicated. If it's starting to talk about like all these agencies and stuff, skip it, because trust me, it's not important. Because if it's going deep into that stuff, really think, okay, what is this telling me what I'm going to do as a nurse? Try to pick away, like, okay, what am I doing as a nurse? If you don't understand one word, like the intermittent claudication, look it up. But if you don't understand, you're reading a whole section, then, ask a classmate, ask me, or whoever your professor is, say, like, what are you getting out of this? Because I've read this 5 times and I just don't get it. There's nothing wrong with asking for help. And I know that can kind of be embarrassing and be like, oh, I don't want to have to ask someone just because I don't understand this. But trust me, you may actually be helping them because maybe they don't understand it either. Because trust me, if you have a question in class, I guarantee you at least 3 other students have the exact same question. Do not spend more than 30 minutes to 1 hour reading at a time. Take breaks and other activities. Like I was mentioning before, don't wait till later to do practice questions. It's not about doing practice questions perfectly. Don't think of them as just, hey, this is knowledge. Do I have the knowledge or do I not have the knowledge? Think of this as a situation. Like every time you're there, you're like, this is a situation that I'm getting in that I need to solve. And so, like, even let's say you get the question wrong, not sitting there like, oh, I don't know this, I need to read more about this. It's just like, oh, okay, this is a situation I could be in, and really try to take, okay, this is something bad that could happen to this patient, or here's something I need to look out for. What could I do differently? And look at the other answer choices and try to think about other bad things that could happen. Is this applied to the patient? Is this appropriate? All right, so it's great to break up some of your reading with practice questions and try to like break down like, oh, okay, I'm going to do a little reading and then I'm going to do some practice questions and see again what stands out. Like, what are you seeing focused on a lot? Don't try to memorize the information, reword it, put it in your own words. It has to make sense to you. And don't try to write and rewrite everything you read. Because I always tell students, like, I was that student in nursing school that I was like, I'm going to have the most beautiful notes. And I like some of y'all like overdid me, but I'd write these really beautiful notes and I'd spend days on them, and then by the time I was done, I didn't even have time to look over them because I spent so much time writing them. So if you find you're the person doing that, basic notes, bullet points, don't try to write everything out, because again, writing it out is helpful, but there's other things you got to do too. So those are some of the big basic ones, but what questions do y'all have overall? Go ahead. Yeah. So the question that was asked was, is the clinical companion a good guide? And from what I've heard, I haven't read in depth in it. I've heard it's a simpler version of the textbook. And I should also mention the other thing that you guys have is we all have access to SharePath, and the lessons, they break down stuff a lot more simple, like in English. So that's another thing you can do. If you haven't started going through the lessons in SharePath, they break down the text. It's from your textbook, and it breaks it down and says, okay, you're struggling with, and it's usually nursing focus, like, okay, nursing assessment for this disease, et cetera. And so it's going to break that down in more simple terms. So the clinical companion, thank you for bringing that up. That is another good thing that you can use. See? Yes, like that. So yeah, so sometimes like if you're reading in the textbook and you're like, where's the English in this? Like, you know, try opening the clinical companion or doing a lesson over it and see if it makes more sense with that. Like maybe the heart failure section, maybe that's what we need to do, because I have to look over it again, because I was looking at it, I'm like, nope, I'm not using this as an example. This is too complicated. So yeah, because sometimes the book gets a little crazy. What other questions do y'all have?
Your Unit 2 resources, I know this is for adult, but do you offer this like for complex too?
I don't have as many resources for complex, but I have some resources, because I taught like half of a semester once in the summer for complex. So I have some like basic stuff, but not in depth like this. But
Okay.
the good thing with a lot of this stuff, this is going to translate. You're going to be using the same textbook in complex. So you can use a lot of the same stuff. And then you can also, like with those reading questions, a lot of the stuff's the same. Like, you know, like, okay, it's like the same thing like your objectives. Who gets it? Who, like, you know, what is it going to look like? What's the, like, especially in complex, you're thinking of what I call the oh crap signs, except I use a different word when we're being recorded. And so what do you call it? The oh crap sign is like the, oh my goodness, like this patient's about to die. Like, what do I do? And so you're much more, because there's like patients are dying in complex. We're like, okay, they're getting worse or they're having complications, but they're not dying. Or in complex, they're dying. So it's more of like, you really have to know that difference between what's normal and then what's a problem. So yeah, so I do have some basic resources, and I have videos, of course, on my YouTube as well. So hopefully those will be helpful to you. Okay. Other questions? Yes, ma'am.
Sometimes in the book there isn't like it doesn't say, oh, this is the most common symptom for this. So it just lists a bunch of them. How do you recommend breaking that up?
Yeah, so if there's like a long list of stuff, like where it's just like, here's the 15 symptoms they could have, you know, try to pick out, what do you call it? Usually they put what's more common in the beginning, like the first few are usually the more common ones. And then you also want to put like, what are the, like some of the scariest ones? So kind of think common and deadly, or like what would be like ones that you were going to have to do something about, but try to like sum them up. So like I always give the example, like in tuberculosis, they give like 6 or 7 of them, but they're all saying the same thing. They can't eat. They're like diaphoretic is sweaty, and they're fatigued or weak, because I use like fatigue and malaise. They mean the same thing. I'm tired. I don't feel good. So try to like find ways to like look at these symptoms and write them in your own words to kind of get a general picture. And I even say, you know, on my Google Drive, I have like a drawn out man, and you can draw on them. That's another thing you can do when you're going through like the clinical manifestations, especially like heart failure. There's a like head to toe changes in this patient. Draw it out, or you can even draw a stick figure on a piece of paper and really say, what do they look like? Because I'm a visual learner, so I think that's good. Because her questions is, well, what happens like if you're in the textbook and there's like a whole lot of symptoms, and how do you break that down? And if there's what do you call it? So you want to break down, like usually you want to break down what the overall picture is. Instead of thinking I have to memorize these symptoms and there's going to be a select all that apply and I'm going to have to choose which ones, really think of what that picture is. That way when you go in, because even if there was a select all that apply, we're probably going to use different words. And so it's not about knowing the words, it's about knowing the overall picture. And if you know what they look like, no matter what words we put on the test, then you're going to be like, oh, okay, this is what they overall look like. This is which of these fits, true or false, true or false. So yeah. And for the sections, I said I was going to talk about this. For the sections like dysrhythmias or other stuff, some sections, they don't have a nursing management. They just have interprofessional care. Go through that and find the stuff. It says, as the nurse, it'll say the nurse needs to teach this. The nurse needs to assess for this. The nurse needs to X, Y, and Z. So focus on what it says for what the nurse should do in those sections, because there's some things we read about that aren't as big and they don't have a whole section for themselves. Yeah. So what other questions? I wish I could go on forever, because I could always talk longer, but I want to get you guys started with this. And then if you're doing this and you're kind of hitting a roadblock, you know, just let me know and let me know how I can help. Any other questions? Okay. I'm going to stop the recording. and end this meeting. But I will see you guys, some of you guys tomorrow. I hope this was helpful. I'll
Thank
see
you so much.
for your help.
Thank you.